First of all, it's an honor to be asked to do the Virgin Forum. I know my predecessor has done a lot. And nobody, I think most of my patients in the audience would agree that nobody can actually replace Bill Koch, but I do my best at trying to keep things level anyway. A lot of people in the community had asked me what a DO is, what a doctor of osteopathy is. And so when I was asked to do this, I figured it would be a pretty cool opportunity to sort of talk about that a little bit so that you all can tell your friends sort of what the differences and similarities are to alleviate some of those questions and concerns. A little bit about myself. I did my pre-medical school training at Penn State Barron's in Erie. There was a 3+4 guaranteed acceptance program with Lake Erie College of Osteopathic Medicine, where I did 4 years of medical school, then 3 years down in South Texas for my residency training in family practice. So that's a little bit about myself. I have a wife and I love dearly and 2 small children, and they are the light of my life right now. So, do you D.O. osteopathic medicine? So today we're going to talk a little bit about what osteopathy is, where it came from, a little bit about what it is, what the differences are, and then the specific cases that sometimes are handled well by an osteopath, or at least a little more quote-unquote holistically. Medicine. This is a little bit about osteopathic medicine. Is about medicine returning to its roots. When we look at the history, 2000 BC, the answer was, you had a problem here, eat this root. Later on, 1000 AD, that root's heathen. Here, say this prayer. 1850, we move on to that prayer is just superstition. Here, have a potion. We move on to that potion is snake oil. Here, swallow this pill. That pill's ineffective. Here, take this antibiotic. Now we're back to that antibiotic doesn't work anymore. Here, eat this root. Osteopathic medicine was founded by a man named A.T. Still. He was a pretty cool guy. He was born in 1828. His father was actually a farmer, a pastor, and a doctor. I thought my life was really, really busy, which it is. I can't even imagine how this guy even had time to sleep. His wife died in childbirth, and 3 of his brothers and sisters died of meningitis. He fought in the Civil War. He was one of the first abolitionists, and Missouri actually granted him a medical school degree. Medicine at the time did a lot more harm than good. If we look at what they tended to use, we had things like arsenic, castor oil, whiskey, opium. Okay, those things are they're pretty toxic. They're pretty harmful, actually. So physicians at the time, even more so than now sometimes, unfortunately, were prescribing poisons to people. And so A.T. Still took sort of a step back and said, how can we do this a little differently? The man suffered actually from chronic tension headaches. And he noticed one time he all the time was plagued by these headaches. So one time he slept in a rope swing by accident across the back of his neck. And he fell asleep that way. When he woke up, it was one of the first times in his life he was headache-free. And he said, maybe there's this tie between how the musculoskeletal system works and some of these pains and problems that people get. And actually, when he sort of invented osteopathic medicine, quote-unquote, osteopaths didn't use medicines at all. They used only manipulation. And throughout time, obviously, that's changed. Now I prescribe a lot more than I do manipulation. So how is this received? How are his ideas received? Well, at first, not so well. Like happens with so many of these movements, whether you talk about the Protestant Reformation or the osteopathic Reformation, if you want to call it that, they aren't usually very well received. The AMA actually officially designated DOs as a cult. That's their term. It was considered unethical to voluntarily associate with an osteopath. So there was this giant rift in the system. Obviously, the guys who were working on this science said that they didn't want to abandon it. They thought there was value there, so they opted to separate reluctantly from the American Medical Association on June 22nd, 1874. physicians. And what's kind of cool to note here, here, and here, women at that women at that time weren't allowed to study medicine. It was no medical schools would accept female applicants. So DOs were actually the first female doctors in the United States were women. So when you hear the term that I've been using called osteopath or osteopathic medicine, technically we're not osteopaths. I mean, osteobone disease, path. That's not really what we do. We're not orthopedics. We don't do only bone and joint. So technically we're osteopathic physicians and we do osteopathic medicine. Now in practice you're not going to hear that, but the terminology on my license says I'm an osteopathic physician. But it's a common misconception that we're only bone doctors, and that's not true. I mean, some of my patients here can tell you, I treat heart disease and I treat blood pressure and cholesterol and all that other type of stuff too. So after this revolution, if we want to call it that, sort of what happened next, a couple of things really contributed to the growth of osteopathic medicine in the United States. One of them was called the Flexner Report. Now, Flexner was a guy, I don't know if many are familiar with the history, but he performed sort of a really broad survey of medical schools in America. And this was back around the time they were just getting started with all this. There were only 30 schools. And, I mean, it was scathing as far as the training of physicians in America. And he actually was responsible for closing quite a number of medical schools, not only on the osteopathic side, but on the allopathic side as well. So osteopathic schools were cut from about 30 to 6. But then 1918 comes around and we have the swine flu epidemic. There was very high mortality flu that went around. Millions died. And something was noticed at that time. Allopathic physicians had a mortality rate at that time about 5 to 10%. So just imagine all the people that get the flu in a year. Can you imagine like 1 in 10 of them dying from it? It's pretty unheard of now. But at that time, during this particular epidemic, it was very, very bad. And so we had awful mortality. To people in the back, are you volume-wise? Am I doing okay? Okay. Thank you. Osteopathic mortality at that time was about 0.25%. So there was this. It was one of the first times when the medical community looked at osteopathic physicians and said, maybe there's something to all this stuff. Maybe we need to start doing some research and looking into things a little further. The other thing that sort of helped osteopathy grow in America was World War I and World War II. Remember that big divide that we talked about between the American Medical Association and osteopathic physicians? Well, that certainly was far from healed at that point. And the Army only employed MDs. And so what happened during World War I and World War II, they all went off and got killed, and the osteopaths were left in America establishing and building up their practices. So that sort of politically helped us to become a little more accepted in America. So after World War II, DOs were growing so fast, and the practices were being built up so much that at least in California, this huge risk. Well, we can't even associate them, but if they want to become one of us, they can pay $65, and we'd be glad to call them an MD from now on. And then you get invited to all the cocktail parties and all that. Eventually, some osteopaths took that route, but it was actually very few. Most of them, there's sort of this vein of pride that sort of runs in any quasi-persecuted group, and back then the DOs were no different. So that actually didn't garner much as far as the program wasn't utilized very much. Eventually, they became so popular in 1966 they were commissioned in the Army. Now there are over 63,000 DOs, so about 20% that's sort of the graph of where doctors in the United States come from. Allopathic grads, 64%. Osteopaths are about 11%. Because keep in mind, 20% of the people going into medical school may be DOs, but only 11% of people coming out of medical school are DOs. There's a pretty high dropout rate regardless of the type of medical school you go into. Foreign doctors are about 20%, and U.S. born grads of international medical schools are about 5%. There we go. So, just kind of a graph showing you how popular osteopathic medicine's become. And this is, when we talk about osteopathy, we talk about how friendly a state is, and how many osteopathic physicians are practicing in a state. Pretty much the darker the blue, no, that didn't come out from the blue there. The darker the blue, the more popular osteopathic medicine is. So Oklahoma, Michigan being two of the most popular. Pennsylvania, I went to school right there. And the red dots are all the osteopathic medical schools. You'll notice, and this is kind of a funny thing, as far as licensing, a state may be really kind of against osteopathic physicians until they get a medical school there with an osteopathic, degree. And then all of a sudden they're very friendly because that school is bringing in a lot of money most of the time. Worldwide, green is sort of where we can practice with an unrestricted license. We consider it sort of one of the themes is, it's medicine born in America. It started here, and it's, less than a couple hundred years old. So, as far as other countries adopting osteopathy, it's growing significantly. Red is where we can practice, but we're only allowed to use manipulation. And yellow is we can obtain unrestricted licenses, but they're kind of tough. Most of Africa is gray because they don't care. As long as you're a physician and you're willing to go and provide care, they don't care if you got your license off a Cracker Jack line. They need physicians. Ghana, I just got back from Ghana a couple of years ago, and they were more than happy to have me. So, that's why that area is gray. So some of the differences and sort of some of the guiding principles of what osteopathic medicine is. Excuse me. There are 10 guiding principles. There's the reference there. The first is the body's a unit. One system doesn't necessarily function independently from another. And that, structure and function are reciprocally related. So if you have a lesion somewhere that interrupts the structure of an organ, it follows that it's going to affect the function of that organ. And this first slide, MDs will agree with this 100%. Okay, this is sort of generally accepted medical theory. The body possesses self-regulatory mechanisms. You get sick, with the flu or whatever, your body is supposed to be able to fight off that infection and regulate things like temperature, electrolyte levels, fluid levels, things like that. The body has an inherent ability to defend and heal itself. Not everything needs treated medically. A lot of things will get better on its own. Disease occurs when those self-regulatory and defense mechanisms are overwhelmed. Okay, so look at cancer. You have a genetic change that the body cannot fight off. It overtakes the body and shuts off. And then rational treatment is based on the things above. So fixing structure can fix function. It's sort of the take-home from that. So things that are sort of specific to osteopathy, the guiding principle is the rule of the artery is supreme. So, movement of body fluids is essential for proper function. I think anybody with a problem with a body fluid can agree to that pretty wholeheartedly. The nerves play a crucial role in the movement of fluids in the body. We know this. Arteries, for example, have smooth muscles around them. Okay, so nerves innervate that smooth muscle. They control dilatation, and by controlling that, they control how well fluids can flow one way or the other. Okay. There are somatic components to disease that are not only manifestations of disease, but are questions that most people have. Um, as far as safety, they did a big survey. That's the Journal of Continuing Medical Education, so a huge journal. They did a study on it. 81% of physicians feel that it's safe. 76% of patients feel it's safe, and that's because patients get a little concerned with the cracking. Sometimes they think you're going to break something in your neck. It's really, really hard to do. I've never done it. And about 56% of physicians, 59% of patients feel it should be available in their primary care physician's office, regardless if they go to a DO or an MD. Over half of patients want manipulative therapy available in their doctor's office. That I think that this is really interesting. 71% of physicians have actually responded that they want more training in how to manipulate, how to do chiropractic in their office. They think it would be useful. They think it would be something that their patients would benefit from. In fact, I forget if it's Harvard or Yale, but they actually said they actually offered an elective course in it. So this is an MD school now offering courses in osteopathic medicine. A pretty fancy MD school at that. So what type of cases and what type of cases do I think personally that osteopathic medicine is really handy in? Well, first are sort of the obvious ones: back pain, neck pain, headache, chronic and sort of acute musculoskeletal problems, even sprained ankles, throwing your back out, so to speak, when it cracks and it hurts real bad. Well, cracking it back a lot of times helps. Non-cardiac chest pain, so I don't know if you ever had those moments when you breathe in and sort of get a wrist catch that wears off and sometimes doesn't after a few hours. That can be helped sometimes by osteopathic medicine. Recurrent hepatitis B is middle ear infection, and some people get really frequent middle ear infections, and there can be some manipulative things you can do to help hopefully the station breathe better and drain that fluid out a little more effectively. Pneumonias, like I talked about earlier with the flu epidemic, a lot of what people died from wasn't necessarily the virus, but they were getting pneumonia on top of the virus that then would be impossible to treat in their ability to time. And so by trying to get the viral part of things resolved more quickly, people didn't get pneumonia as much and they got better. And GERD, which I alluded to earlier, reflux issues, real bad heartburn that never goes away from day to day to day. Sometimes you treat the back and it gets better. It's that typical relationship between structure and function that we talked about earlier. So if you go into an osteopathic physician's office that's going to do manipulative therapy, sort of how does it all happen? Diagnosis is 100% based on palpation and range of motion. There's no special machine, there's no blood test, there's no electrical tubing that we can hook up to and say, oh yeah, that's your problem. It's all done by touch and feel. So tissue feels different when it's inflamed or when it's chronically strained or stressed. You get like a boggy or ropey feeling sometimes, warm versus cold. Same with the asymmetric. You look at somebody's back as they're laying on the table and you'll have a bump on one side. And you go, I think I need to work there. I think that'll be helpful. Restriction in range of motion is a big one. People, I use, when I lay somebody with feet towards you and head towards me and their nose sticking straight up. Normally it's not that big in relationships. But you can actually see almost like a degree angle. They'll be able to tilt their head this far one way and then only this far the other way. And so by working with them, and at the end of the visit, you look down and they can go like this, like normal. And so tenderness is the other thing. You're moving down somebody's back and that's where we need to work. So some of the techniques that we use, a bunch of big words up here, but one's called suboccipital release. That's the idea that I talked about earlier with A.T. Still and the rope sling. It's basically pressure right under that bump in the back of your skull. Those muscles actually attach all the way up here, something called the aponeurosis. And so HVLA, we call it called high velocity, low amplitude, which is cracking. Most people know it. We like a more scientific sounding term, but it's cracking. The studies that have been done, so whenever you do something new in medicine, everybody wants to study the death out of it, and OMC is no different. They looked at that versus drugs for low back pain, and they found that at the same time to equivalent resolution. So most people, whether you give them drugs or do OMM on them, they all get better in about the same amount of time, and no side effects with OMM. There's really nothing. You may not get better, just like with drugs, you may not get better, but you don't get worse. And a Cochrane review, which is they get all the data that they can, and they sort of study the studies, if that makes sense. They say it works better than placebo, and usually people get about 3 months of resolution out of it. Same in the UK when they study it. So that was really fast because I'm running out of time, so I was